What we see in many hospitals, especially around Asia, is that they rely on manual methods of communications, whether that's using overhead paging to send out critical alarms like code alarms, code blues, code STEMIs, or even in some cases manual calling around doctors and nurses to get them to attend certain events. What Spok is able to do is to send out those alerts simultaneously and securely to devices that staff carry, whatever those devices are, be it Wi-Fi phones, be it smartphones for a secure and encrypted app. So the direct benefit to patients really is that it takes less time to respond to these emergency events, life and death situations where time really matters and you need doctors, nurses and other medical staff to respond as quickly as possible. Indirect benefits, really, we see things like discharge times in emergency departments decreased by, say, 10%, so patients waiting less time in the ED. One particular customer of ours saw their what is known as daughter balloon time for a code STEMI. They saw that activation time reduced by almost half as a result of adopting our solution. Yeah, I think once the users, specifically, let's give you an example, i.e. nurses, understand that it's going to make their jobs easier, it's going to make them react faster, it's going to mean that they have to walk less distances. Nurses already walk a lot within the ward, back and forth between the rooms and the nurses station, and they're going to be able to spend more time caring for the patients and at the bedside where they should be, and less time running around in a disorganized fashion. When they see the direct benefits to themselves in that fashion, then they're very keen to adopt the technology. And what we really aim to do is to make them more efficient, make them able to respond faster, make their daily job much easier. Yes, so we have what we call a critical test result notification application, which is for laboratory and radiology. What the Spok system does is it takes over that communications role from, say, the radiologist, so they can continue doing examinations whilst in the background the Spok system is securely and encryptedly delivering test results to the doctor. And for instance, it could be the requesting doctor that requested that test result. They will receive that result as a push notification on their smartphone with a unique ringtone. So, before they take the device out of their pocket, just by the tone, they will know this is a critical test result. I need to look at this straight away. And then based on the business rules of the hospital, they'll have so much time that they have to acknowledge and read that message. If they don't, then we will start an escalation path where we could then go into the hospital's on-call database and we could see who's on duty for emergency and forward that result to another physician that could look into that result. So on-site, we work with a range of on-site devices that hospitals might carry. So typically Wi-Fi phones, voice badges, deck phones, pagers, EDIS display boards, and then off-site devices such as smartphones we work with as well. We also see some smart devices that maybe are not telephones but smart devices being used within the hospitals, maybe such as tablets. We can also notify out to those. So as a company, we're device agnostic. When the doctor receives the result notification and they can read through that result on their smartphone, there's actually a link included in there that they can press a callback button, and that will initiate a call back to that radiologist. So if they want to ask them any specific questions around that patient, around the test result, they can. At the same time, when the doctor acknowledges that result, we will update the EMR, the electronic medical record system, and we'll close the loop in that medical report. Thanks for asking that. It's a question that comes up a lot, and our application is what's known as HIPAA compliant. So it's it meets all of the guidelines around sending secure and confidential patient data to a mobile application. So regardless of whether a user's phone is secure, especially if it's BYOD, you can't force someone to secure their phone and say that's your device and we want to put MDM on it. But what we can do at Spok is we put a layer of security around the application itself, so that if someone wants to view that patient data, view that result, we can password authenticate the actual app. Secondly, on top of that, the application, the data that sits within it can be remotely wiped. So, and that can be done automatically or manually. So we might say we want to delete all messages stored within the application once every 24 hours based on hospital policy. We can do that. Or if a user calls up and says, hey, I've lost my phone, we can, again, wipe all of the data that exists within the application. If they use our application to take a photograph, for instance, sometimes they want to take a photograph of a wound to share with another physician, because we do support physician-to-physician based communications through the app, secure messaging. If they take a picture using the Spok mobile app, the photo is not stored on the camera roll of their phone. It stays within the app. So if anyone has access to the phone, they cannot see that image. So, a byproduct of taking something like critical test results notification and having that Spok mobile app that meets all of the security and regulatory requirements around secure communications is, a doctor, as well as receiving test results and other important notifications about their patients, can now message their colleagues and have, secure conversations with their colleagues around patients. Whereas today we see them using, non-secure social messaging tools. We're actually connected to the enterprise directory at the hospital. So you can search by name. Sometimes you don't know the name of the person you need to speak to. You might know, I need to speak to a cardiologist, and I need to speak to the on-call cardiologist. So in the Spok system, you just open the app and tell it you want to speak to a cardiologist. It'll actually look up in the hospital database and tell you who's on duty right now in that role and allow you to message directly out to that person. Staff become more efficient, communications become more efficient, so less time is wasted. If your staff are wasting less time and becoming more efficient, that means more revenue. If patients are sitting in waiting rooms for less time and being discharged quicker so that more patients can come in, again, that's more revenue and more return for the hospital as a result. A lot of hospitals, they tend to silo it department by department. We work across the entire enterprise of a single hospital and multi-hospitals, and when they look at that sort of enterprise and hospital-wide approach, they see that it's much better than making siloed departmental-based decisions on their procurement. 3 words: is it purpose-built for healthcare? That is really one of the most critical decisions that they have to make. If I'm looking at buying a solution and it's an IT-based solution, and there are many solutions available on the market, I want one that has been designed with healthcare needs and requirements in mind. We're talking about connecting IT equipment to medical devices that are connected to patients. So again, we need a technology that is purpose-built for that. The right message to the right person, right device, right time. And that's really what Spok does. From my experience, personally, I would say that it very much has to be a phased approach, departmental. Look at the enterprise as a whole, as I said before. Don't look at siloed-based solutions. Look at a solution that is going to serve all departments of the hospital, but don't try and roll out everything all at once at one go, and then make sure that users are trained effectively. The doctors and the nurses need to know how to use the system. If they don't know how to use them, if they're not trained properly, then they're going to blame the technology, and it's not going to make their job easy. That's one of the unique things about Spok as a company is that we work directly with the hospitals, and we train staff directly. So we train doctors, we train nurses, we train switchboard operators how to use our technology, how to use the app on their smartphone. So we give them that degree of confidence of using the technology, and Again, in my mind, I don't find other companies that go to that depth and that level of really making sure that the user is comfortable enough to make that change because they haven't been trained enough.